Hi, I'm Andy Weibel, and welcome to Timely Topics. Today we're going to be talking about World AIDS Day and HIV prevention, and with us is Ann Kuhn. Welcome, Ann.
Hi, thanks for having me.
Ann, tell me, you're a prevention specialist with the McLeese Clinic.
Mm-hmm.
Can you tell us a little bit about what a prevention specialist is and what the McLeese Clinic is?
Sure. The McLeese Clinic is actually an HIV treatment clinic at Hackley Hospital. We have 2 infectious disease HIV specialist doctors. We have RN case managers, a housing specialist. We have a grant writer, pharmacist, and then Michael and I are the prevention specialists. So we run
Michael Ramsey?
Michael Ramsey.
Okay.
We run Prevention Practices, which is an HIV prevention agency. A prevention specialist is basically kind of like a counselor, a certified testing counselor. And we do community outreach, education, obviously free and confidential HIV testing, and referral services. We don't have to make many referral services to agencies other than usually public health for STD testing or McLeese.
Okay. And I mentioned the World AIDS Day is coming up. I think it's December the 1st officially. What role do you see World AIDS Day, and what is World AIDS Day?
Well, World AIDS Day is every year on December 1st, like you said. And it's a worldwide, it's kind of a global day where people can unite to raise awareness for HIV, support those who are living with HIV, commemorate those who have been lost to HIV. And it was actually the first global health day in worldwide, and it was first recognized in 1988. So it's been around for quite some time.
Yeah. Now, HIV is worldwide. I mean, it is World AIDS Day, and so it's not just in the United States. It's really
annually or globally, I guess I should say, there are 34 million people living with HIV currently. 35 million who have died from HIV or AIDS, which makes it the deadliest epidemic around.
Wow.
Around the globe.
And how about in the United States, approximately how many people are living with HIV? Do you know?
I don't have numbers for the United States. I have numbers for Michigan or for Muskegon County.
How about Michigan?
It's pretty, well, in our area, Muskegon County and outlying areas like, the north and just a little bit south of us, we have about 180 documented cases. About 150 of those are currently in treatment with us at McLeese Clinic. Bear in mind, some people don't seek treatment where they live or don't have treatment where they live. So we do have some patients that come and travel. And we also have some clients who don't feel comfortable having treatment in the area where they live. It's a small town, so there are people that work in the lab or people that work, in the ER or places where you might see them at Hackley Hospital. So some people do choose to, be referred out to St. Mary's and Grand Rapids. So, but we have patients that travel from all over for treatment.
And how I assume some people might have the disease but not know about it?
Oh, absolutely.
Yeah.
Actually, a staggering new number that came out this summer right around National Testing Day. In our country, an estimated 1 in 5 people are living with HIV and don't have any idea of the infection.
Wow.
There aren't a lot of symptoms when you become infected. There could be, depending on, the level of infection of the person that infected you, there could be some like flu symptoms, fever, achy, cough, because your antigen level spikes. But once that goes down and your body begins to create antibodies, those symptoms go away. So usually if somebody has body aches, their first thought is an HIV.
Right.
And that actually, during that time when you are ill and your antigen level is high, that won't show up on an HIV test, on a rapid HIV test.
I see.
So there's usually kind of a window period with testing, 25 days to 3 months. So if we meet somebody and the risk, maybe we've assessed that it's during that small window of time and the test is negative, we would retest. If there was an extreme risk, we would just go directly to the lab and do like baseline blood work.
And that's a little more accurate, isn't it? Okay. And so with World AIDS Day, what do you have going on?
So many things.
So many things, okay.
We don't ever do anything small.
Yeah.
We have our second annual, I guess you could call it, Everyday People art installation, and that is going to be Saturday. Well, I guess I should go back. Friday, we have a screening of a documentary called Endgame, AIDS in Black America.
Okay.
We're going to screen that at Hackley Public Library at 2 o'clock. That is free. Saturday, we have Everyday People. We're going to install a lot of Everyday People this year. We have many left over from last year, and we have new
Can
artists.
you kind of explain what Everyday People?
Sure. They are, they're 6 foot tall wooden figures, and we have different artists and different community members that are decorating Everyday People with the premise that HIV looks like everyday people. It doesn't discriminate race, gender, religion, sex, any of those things. So we just have people that want to decorate the everyday person however they interpret that. We install them on the corner of Western and First Street downtown the Tuesday before Thanksgiving. So there's plenty of time to get down and kind of look at them. But Saturday we'll have a small reception with some donuts and coffee from 11 to 2. And Michael and I will be there to kind of answer questions or navigate that. Sunday's our day off. Monday we have our open clinic.
Monday's the first, right?
Yep,
So,
that
okay.
is World AIDS Day. And we have a clinic every Monday from 10 a.m. to 7 p.m. It's a walk-in clinic, so anybody can come in and get an HIV test without an appointment.
For free, right?
Oh, for free. Everything's always free.
Okay.
And we do have a refer a friend program for our Monday clinics. If you bring somebody that needs an HIV test or you both need a test, you can get a $5 Wesco gift card or a round trip bus pass, so that's kind of nice.
Sure.
Transportation is usually a barrier for people for testing, so we like to eliminate that. But because we have to be in our clinic on Monday, we decided to have kind of an open house. So we're hoping, obviously, that the community will come for testing like they always do, but maybe some members of the hospital or some other staff members will come by. There are many people that work for Mercy Health that don't really know that we're there.
Yeah, you're kind of
so
separated in some ways.
We are kind of separated. So it would be kind of nice if we could just have some visitors.
Sure.
So
And
yeah,
everyone's invited, right?
Oh, everybody is
Yeah.
invited. Anybody can come.
Oh,
Yep.
good.
Yep. We'll also probably have some treats and giveaways that day as well.
All right. And then what about the second on
The
Tuesday?
second, we will be here at
Okay.
MCC outside the Blue and Gold Room.
Okay.
We will have many, many testers on hand. And we don't really push testing World AIDS Day, National Testing Day we do, but we more focus on education for the community, stigma reduction. Testing is always great. We encourage testing, regular testing. We like to, it's customized for people who get an HIV test. So you're going to get a customized risk reduction. We're going to, assess your risk, determine it, and kind of come up with creative ways for you to reduce your risk other than testing, because testing doesn't, stop
Reduce
you from
risk.
getting from any HIV, but it's incredibly important for you to know your status. You can't practice your risk reduction if you don't know, what's happening with your body. So
Sure. And so who would you suggest get tested?
Well, everybody should have an HIV test. We say about once a year if you don't have any lifestyle change. Like I said, it's tailored to each person. We think that if you're in a monogamous relationship and you're reducing your risk by using condoms or other risk reduction methods, maybe once a year, every 6 months. If someone has just maybe a higher risk or we identified a specific risk, we would test more frequently. Or if something changes in your life, if you start a new relationship or you have a work exposure or anything like that, you should be tested.
Right.
Yep.
And so if I was talking to some students about HIV testing, and one person was worried, said, well, what if I test positive? What happens then? Am I just going to be left alone?
Oh, no way, never. We actually, what we would do, we can do 2 rapid HIV tests from 2 different manufacturers. And both of those tests need to be positive.
Okay.
And that is considered a case with the state of Michigan. We have several case managers in our clinic, so there would basically be an immediate intake. We would obviously not just diagnose someone and say, have a nice day.
Yeah.
They would get lab work, and we would do kind of an intake assessment and get them set up with an appointment for the treatment clinic, so that when they had their first appointment at the treatment clinic, our doctors and nurses would already have, their lab work, their CD4 counts, their viral load, and all of those things ready to go. But Michael and I, one of the cool things is that we are sort of the support system, I guess, for the community. So if someone were to have a positive result and we take them for lab work and they have to wait, a week for their appointment, we're available 24 hours a day, 7 days a week. So we are sort of like the talkers and the support. So there's definitely a lot of counseling involved.
Okay.
And so we kind of help process all of that. If they want, whoever delivered their positive result, whether it be Michael or myself or one of our nurses, we can stay with them if they would like company at their appointments or company at the lab or anything like that.
And is there, there's no cure for HIV, but there are treatments, right? Can you talk a little bit about that?
There's no known effective cure for HIV. There are, however, many very highly effective treatments for HIV. A lot of people, the first question they ask is, how long will I live? Or, what does this mean for me? Is this a death sentence? And we typically just say, you're going to live as long as you want to live. That choice is up to you. Back when HIV first reared its ugly head, there were terrible treatments and they killed a lot of people. So now we have, just some easier treatments, less side effects. Some people, don't have to take pills all day long. Some people do. It's more of your adherence to the medication. If you're willing to do what your doctor tells you and take your medications, you can live a very healthy, very productive life.
Okay, and what? Of course, if you are HIV positive, there's still some stigma out there. How do you deal with that in your counseling? I don't want people to know, or do want people to know?
Well, it's a really personal thing. Disclosure is a very personal thing. If someone wants to disclose, we've given advice to people who do want to disclose.
Do you have some people that are willing to talk at groups and whatnot?
We actually do have, Michael does facilitate a support group for men who are living with HIV, men who have sex with men who are living with HIV. And that has been fairly successful. It's pretty new. But stigma is one of those things that we fight on a daily basis. It's incredible how many people that we meet in the community, educated people, uneducated people, who really just don't know the basics of HIV. It's not taught anywhere. So if they haven't met us yet,
not taught anywhere. Is it taught in the schools? Or?
It's not taught in the schools.
Really, not at all.
I believe. Well, the state of Michigan has several modules for schools. Each school district can select whichever module they're comfortable with teaching as far as health and sex ed. And in Muskegon, it seems it is abstinence only, which is fine. We don't encourage or teach anybody how to have sex, but they touch on STDs. You can get STDs from unprotected sex. You can have unwanted pregnancy from unprotected sex. You could get HIV. This is what it is, and then that's pretty much it. So there are just so many nooks and crannies with HIV, I guess you could say, and to glaze over it as far as education is concerned, it's upsetting. It's upsetting to me. I think it gives an incredible disservice to our community to not having provided this education.
Right. And I guess let's talk about, since maybe some youth are watching,
I hope so.
What are the main ways of getting HIV?
You can get HIV 4 ways, 5 technically, but unless some of them are brain surgeons, we'll just say 4 ways. Blood, which would be a work exposure or needle sharing, whether it be a diabetic needle or substance abuse with injection use. Semen, obviously, vaginal fluid. Those 2 would be with intercourse. And the unknown one that surprises everybody is breast milk. And a lot of people aren't in contact with breast milk, I don't think, but it's definitely something that folks need to know. If someone had a pregnancy and they didn't receive any prenatal care or any lab work, they might need to know that they should probably be tested before they breastfeed their child.
Okay.
So we typically say anytime you're going to come in contact with any body fluid, there should be a barrier. There should be, a condom or a dental dam or some sort of form of contraception.
And how about saliva? Some people
No
ask.
Saliva.
No, it does
Nope.
not. Okay. And so
You would have to fill a swimming pool with saliva.
because it's not that
Right.
much in it.
Yeah.
Right. Okay. How about we talk about probably the safest would be abstinence.
Sure.
And then what would be safer sex?
Okay. Well, abstinence obviously is everyone's favorite word. It's their first go-to choice, but I don't think it's realistic. We're all here because
Because of
someone
sex.
was in abstinence.
Yeah.
So the next obvious form would be condom use. Condom use with lubrication. We always have like a bowl of lube on our table
Okay.
whenever we go to events, and no one ever knows what it is. They think it's hand sanitizer or it's lip gloss. So it's just not being taught that. I mean, some condoms have lubrication, but obviously they're much safer if you use lubrication
Additional.
also and a condom. It reduces the risk of the condom breaking. It reduces any friction and tearing. So it's incredibly important to use lubrication with condoms.
Okay. And so use condoms, and this is both for vaginal sex and anal sex
Absolutely.
as well, right? And what about oral sex? I hear a lot of people saying that's safe. Is that safer? I assume it's safer.
It is
but
safer. There's always levels of safety, and some are going to be safer than others. And we don't try to eliminate a risk because it's not real. It won't work. So we just reduce risk. So some of the ways, I don't know how much I can say about oral sex.
Oh yeah.
Some of the ways that you can reduce with oral sex are using a dental dam, which is kind of like it's almost like a condom, only it's much thinner and it stretches, and you use that as a barrier for performing oral sex on a woman.
Okay.
There's not a ton of risk with oral sex in women, but we do still say use a barrier. For oral sex, you can use a condom. A man can still wear a condom and receive oral sex. It's not preferable. I haven't met anybody yet that says they enjoy it, but it's something we would ask you to try. And obviously, if someone is going to ejaculate and you're performing oral sex, we would say to either swallow it or spit it out.
Okay.
Oral health is really important as far as oral sex goes. We don't like anyone to, that's a terrible way to say it. We tell people not to brush their teeth or floss about 4 hours before they think they might have oral
that
sex.
can cause cuts and whatnot. In the
Little
gums.
cuts. Your mouth is just a thin membrane, so it's very easy to have some tearing in there without knowing, or some irritation in your gum line, because that is obviously a way for transfer. It's difficult for HIV to live in your bloodstream, or not your bloodstream, your digestion.
Digestive.
So it's either swallow or spit, but don't let it sit. That's usually what we say.
Interesting.
Yeah.
All right. Well, that's good to know. So, how about what are there certain groups that are like more susceptible to the disease than others that maybe you
Sure.
focus on? Can you talk?
Sure. Actually, it's still men who have sex with men is still among the higher risk. But the next higher risk is actually African American men who have sex with men, and African American women, and teens.
Okay.
They are by far surpassing the rate of infection for just, the box of men who have sex with men. Our clinic, our agency, is funded through the state to target a specific demographic of African American men who have sex with men, men who have sex with men, and high-risk heterosexuals, which are classified as like needle sharing or substance abuse.
Okay. And how do you target such groups? I mean,
We have to be very creative.
Yeah.
There are a lot of cultural barriers within the African American community. It's not easy for a homosexual African American man to kind of come out or feel accepted.
Yeah.
So there's a lot
So
of
often on the down
down
low.
low. It's also difficult because Michael and I are obviously white people, and so a lot of
The
times
trust
it's
is-
like, here comes this nice white lady with white lady syndrome, and she's going to come and teach us all. So we usually just kind of call it out and say, I understand I don't look like you. I don't have the same cultural background as you have, but I know a lot about what's happening to people who do look like you. And usually after a couple of minutes, they're comfortable talking to us. But it is difficult. We have had a very difficult time penetrating that group, the African American men who have sex with men. We typically like to just host events in the community where we are giving things away, maybe lunch, and not so much focus on testing, but more just kind of everybody getting to know who we are and recognizes our faces. And we just kind of talk to them and educate them, and we've been pretty well received. We have.
Right. And churches are a big part of African American
They are.
community, and have they been helpful in making connections?
Some have. We have some ins at a couple churches with a couple of people. We actually just kind of launched within churches. We sent letters to about 240 churches in the area, and in trying to encourage them to meet us and maybe host a class that we would call Understanding HIV in Your Community. About 8 churches responded,
Okay.
but we'll take it. So we are starting in January to kind of schedule those programs, and those are for church members, church staff, and communities. So it will be like a one-time class, but basically HIV 101. It's in your community. It's affecting people that you love. You probably, aren't aware, and so we're hoping that will be largely
That'll
successful.
spread and
Yes.
get into more places. How about men having sex with men in that general category? How do you target such a group? And there is kind of a gay bar here.
Yeah.
Do you work with them?
That group is actually, we've been very well received with that group.
Okay.
It's not that hard to reach out to them. Personally, I have a lot of friends who are gay men. And so we, of course, started with Moe's, and Greg has been very generous in letting us use space and come in there and do education and testing. And
Okay.
it's very much word of mouth with that group, and we have some really great supporters. We've gained a couple volunteers that way. We have a volunteer named Roger, and he's our right-hand man. He's always with us with all of our events.
Great. And I just thought it might be a little difficult compared to, say, Grand Rapids, that has the network, which is kind of a gay resource center or LGBT resource center. But you still feel like you can get out in the community, even though we don't quite have something like that here.
Yeah, we do. And we will host house parties, which haven't been wildly popular yet. We're hoping they will catch on a little bit. But someone could host a party in their home and invite, a handful of friends, and the host gets a gift and maybe have some food, and we can just make it fun and do education and do free testing. It's not as confidential that way, but typically if someone is willing to come to a house party that is offering HIV testing, it's sort of off the table. All of their information stays confidential, so we have to have a space. We can't do it in public or anything like that.
Right.
So it's easier for people to kind of open up and talk about what kind of sex they're having, who they're having it with, how often, when they're using protection, all of those things, how often they're tested. All of those things need to happen in a confidential space. We are hoping to begin couples testing. That's my next hurdle.
Oh.
So that is nice. A lot of couples prefer to test together and kind
Sure.
of have those conversations about their risk, together.
Right, right. Well, one other group you mentioned was youth. And what age groups are we talking about, and how do you target them?
There's a very high rate of infection among African American youth between the ages of 13 and 24.
Wow, okay.
We can test anybody who's 13 and up without parental consent. That makes a lot of people very uncomfortable.
Sure.
But if a 13-year-old comes into my office and says they need an HIV test, we're absolutely going to give them an HIV test.
And HIV tests used to be blood, but it's not anymore.
It is
right?
blood.
It
Yep,
is blood?
we do blood.
Okay.
There is a oral
Oral.
mucosal swab that we can do, but we do
do.
just a small finger prick. It's sort of like a diabetes test.
Okay.
Take a very small amount of blood. It typically stops bleeding before I can even get the Band-Aid on, so it's not invasive. We
minor,
aren't,
yeah.
Doing any phlebotomy.
Okay, right.
No, but we do have the swab, and that's typically the test that we would use for a confirmatory. So if someone had a reactive result on their first rapid test, we would use the swab to do a confirmatory.
Okay. And then about youth, you would do testing if they want to come to the McLeese Clinic.
Absolutely.
Or if they come to MCC on December 2nd. What about, do you go into high schools? And
We do not.
No.
I would leave this table and go into a high school right now if somebody would let me.
You can call.
Right, please. We think it would be incredible if we could get into schools. A lot of the resistance comes from parents, we have found. Although it's just starting to shift, we have some parents that will call us and say, I don't know how to talk to my child, or I don't have the tools or the information. Would you talk to my child, or will you teach me how to do it? We don't teach anyone how to have sex. We are very sex positive, so we're very non-judgmental. There's not a whole lot people say that shocks us. But if if a teenager needs an HIV test, something is happening. And clearly no one has had a conversation with them about what is happening. So we would love to be able to go into schools and just really get bare bones about it and not promote sex, not hand out condoms, not do any of those things. We would tell them where to find the condoms, but we wouldn't, bring them to school. But that is something we absolutely would love to do. We have to be invited in. So we've done some classes at the Reese Puffer GSA, which were successful. So we can't just, we've got to have an in, and typically parents aren't really happy about that.
Well, let's end things by saying, how does one contact you if they'd like more information?
Many ways. Our agency's phone number is 231-728-5668, and that is my desk directly. We do have a hotline number. You can call or text 24 hours a day. That is also area code 231-329-5105. A lot of folks call that number and just ask anonymous questions. They text and say, I need condoms. Pretty much any question you can think of,
Okay.
we've been asked on that cell phone. So.
All right. Well, thanks for coming on the show, and
Thanks for having
thanks
me.
for all the good work you do.
Oh, thank you.
And thank you, everyone, for watching Timely Topics. We've been talking about World AIDS Day, which is on December the 1st, and some activities happening on December 2nd here at Muskegon Community College. And we've been talking to Ann Kuhn, who is a prevention specialist at the McLeese Clinic. Until next time, have a great day.